There are imaging biomarkers that can image amyloid, for example, which has to be seen in the case of Alzheimer's disease. But even now, the revolution in recent years has been blood-based biomarkers. These started off as perhaps not so accurate, but now in the last couple years have really become accurate to the extent that they rival imaging or spinal fluid testing, which were considered the gold standard. Obviously, blood-based biomarkers, getting a blood test is a lot easier than getting a spinal tap. And even the imaging test. Imaging tests are expensive. They require people to lay still in a scanner, which some people don't like to do. And they're not always available, depending on insurance, for example. But the blood-based biomarkers are much less expensive, and that can let the clinician taking care of the patient know what the underlying diagnosis is. So the biomarkers that have been looked at include A-beta 42 and the ratio of A-beta 42 to A-beta 40, which I think is a little bit better, and then the various forms of phosphorylated tau. p-tau 181, 217, and so on. The biomarkers are related to a classification, a pathobiological classification system in Alzheimer's known as the ATN system, or I think recently extended as the ATXN system. And ATN stands for amyloid, the A, tau, the T, and N, or neurodegeneration. And you can have various combinations of them, of course. The amyloid could be present or absent, tau present or absent, neurodegeneration. But for the changes that take place where you have an amyloid biomarker, that's considered within the Alzheimer's spectrum of the disease, or the Alzheimer's continuum of disease. So as long as amyloid is present, tau being present or not suggests that there may be neurodegenerative and synaptic changes. The N, declares whether there is additional neurodegeneration, for example. But if the amyloid is positive, then there is some Alzheimer pathology present. Testing for blood-based biomarkers versus testing for cerebrospinal fluid biomarkers, it's an invasive procedure. It can be potentially performed in the office. We often have it performed fluoroscopically. Our radiologists do this for us. Some physicians will do this in their office or at the bedside, but again, it's considered to be a relatively invasive procedure. I think the emphasis overall is that spinal fluid is a very safe procedure overall, but one that just is unfortunately invasive and somewhat expensive, and not available in every office. The results from spinal fluid testing are highly accurate in terms of diagnosing Alzheimer's disease. Blood-based biomarkers, much easier. Like any blood test, it can be performed in nearly any office and in any setting. They are less expensive, I think, overall than spinal fluid testing and the involved procedure that has to be done. So it's just easier for the patient and can be obtained more readily in an office setting. One does have to be careful in interpreting biomarkers. There are a number of factors that can influence the result. Dyslipidemia, hypertension, chronic kidney disease, for example, can affect the results of biomarkers. A number of the different biomarkers, including ones for neurodegeneration, synaptic markers, and the p-tau 217 marker. Atrial fibrillation, cancer, stroke can have some effect, postmenopausal hormonal therapy. And we are finding out that race and ethnicity may have an effect as well, because sometimes people coming from Black or African American background may have different thresholds for the biomarkers and levels of amyloid than we might see in white populations. So we need to be just aware of that. I think in many patients, of course, and many families would find it very important to know what the specific diagnosis is, as opposed to, you have dementia or mild cognitive impairment and we think you have the disorder. We don't know that this is the disorder, whether people can be in, different research studies, for example. So it's important to have that information.